So now that we've completed this patient and we're ready to send it to the provider, that's when we come up to our three amigos and the evil brother, and we want to send it. So we go to the green arrow, and this will pop up a message box. And for this example, we're basically going to send it to ourselves, but this would be the provider that you're going to send it to. And then subject line will drop down, and you can say they're in exam room 3. So it has the patient here, and this is where you can add information to maybe give your providers heads up. Say, patient is very anxious today, has gun, be careful. So this will give your provider a little heads up, probably wants to hurry and get in that room. Another good habit to get into is when you're sending these for patients that are waiting to be seen, go ahead and click them high priority. This will bring it out a little bit more attention to the provider as they're seeing these patients coming in. Versus other messages may not be high priority. So we want to go ahead and send that. And when we look here, you notice we're back at our desktop. Again, we can toggle back and forth here if we had an open patient. But we take a look here and we say, okay, we've received a chart. As you can see, this is turned red, and it shows me that I've got a new chart in there. And I come up, and this patient is ready to be seen. And I can click that, and I see the message. And I can see what time the message was sent. Here's that note that we added. And I say, okay, so now I'm going to take over that chart. So now I've got a patient open up. If I ever need to get back to my desktop, I just click, and I'm back to my desktop with the appointment screen, and then back to the patient. So now as a provider, I come in and I need to find out some information. So I look and I say, okay, well, here's their problem list that I look over. I can see current medications, anything new there. Also, I can look at those results and so forth. So I want to kind of know what is the reason for coming in today. And with this, we've set up short list here. And for the providers, you basically can choose by your specialty. So, example, we'll say this patient is coming in today and seeing one of our family practice or internal medicine. And this patient's coming in, they've got a problem with low back pain. So as we scroll down here, we can look for back pain. And I think I went right past it. Yep, there we are. Back pain. So we pull that up. Now you see the questions here, you do not have to fill every single one of these out. Otherwise, don't change the way that you're practicing medicine, just change the way you're documenting it. We all ask several of these questions, so we don't have to ask every single one of them, but we want to document enough to get a good idea of what's going on with the patient. So we can ask the patient, okay, where is it hurting? And the patient tells us that it's the low back. And as you notice, as we tick here, the computer starts to write the note for us. The injury involved the lower back. We can say time frame. How long has this been going on? We can say it's been weeks. Well, the computer wants to know how many weeks. So we just enter a number. And we're going to say it was 3 weeks ago. So now our note has that in it. And we can say, well, how did the injury occur? Well, it happened at work. Now, if we want to add a little bit more information to that, we can add a little note to that. And you see we pop up, and we're going to say patient works. Yep, say somehow I got spelling check. Patient works at Harris Teeter. And when we click OK, that note now comes down within parentheses to further describe where they work at. So this is a way you can add some details. We want to try to stick to our tick boxes because our computer cannot read your writing per se. Otherwise, when it's calculating visits and so forth, it wants to see it in a tick box. And we come down, we say this happened with a fall. Okay. And again, we can add more information. We can say they slipped at the salad bar. And when we add that in. So this is how we get those key components. And you can see this goes on several different things. Some of these chief complaints are smaller, so not all of them are quite this extensive. So we come back, we say, okay, well, what if the patient has another complaint? What if they come in and now they're saying that they have a problem otherwise? For example, say they've got an asthma flare. So we can click on asthma. And again, that same box comes out, and we can add some details here. And we'll just click a few to add in here. And we can say this has been going on now for 3 days. And we click OK. So that's how we would document that chief complaint, or what's called reason for visit. Another component that you'll see here is you can always go to the master list, which allows you to look at everything in the system, but that's a lot of information. Short list is what we've customized for our practice, so you're going to find your most common things here.